You're listening to Saturday with Ted on Newstalk 1010.
Thank you, Bill, on that beautiful Roland keyboard. Dr. Martin Jugenburg is with the Toronto Cosmetic Surgery Institute. And chances are you've seen it. It's in the lobby of the Royal York Hotel downtown in Toronto. He has joined us in studio. Nice to see you.
Thank you very much. Thanks for having me.
Thank you very much for coming on the program, Doctor. I appreciate that. I was fascinated reading through my notes that you talk about reconstructive surgery and how, in fact, that helps the healing process for women. I'm talking about breast surgery following mastectomy.
Absolutely. Well, October is a Breast Cancer Awareness Month, and we'll be having what's called a BRA Day, Breast Reconstruction Awareness Day, October 16, which is a Wednesday. Mm-hmm. Now, breast reconstruction is an important aspect of healing for patients with breast cancer. Breast cancer can be a potentially devastating illness, and one of the treatments is mastectomy. A mastectomy really takes away a breast or both from women, and breast reconstruction allows women to recover and live a healthier, normal life after the treatment.
And how common is that now?
Breast cancer is one of the most common cancers women have.
No, but the actual reconstructive surgery following a mastectomy.
It's not too common, and that's the problem. And that is the reason why there is such a thing as a BRA Day. BRA Day was developed a few years ago by Dr. Mitch Brown in Toronto, and it's meant to increase the awareness of breast cancer reconstruction. Most people don't realize that breast cancer reconstruction is available to them. In fact, the latest statistics in Canada show that maybe 9% of breast cancer patients actually end up getting a breast cancer reconstruction. Mm-hmm. So that's a number that's too low and needs to change.
Mm-hmm. So there must be complications or at least difficulties when a woman has but one breast removed to kind of match them up, as it were.
Yes. So breast cancer allows women to regain their body image, self-esteem, and breast cancer creates what's called a breast mound, recreates a breast. There's two ways to do this. You can do this using your own tissues or using implants.
And which do you prefer?
Well, they both have pros and cons. Using your own tissue allows you to create a more natural-looking breast. Mm-hmm. However, it's a much more complicated process. Breast implants allow us to do a simpler, quicker surgery and get people back on their feet quicker.
Right. Now, what is this changing to a more bizarre topic? What is a Brazilian butt lift? I can imagine, but I need more information.
Well, a Brazilian butt lift is a cosmetic surgery procedure. It's not really Brazilian. It's not really a butt lift. What it is, it's a butt enhancement procedure, which combines two things. One, liposuction, taking fat from areas where people don't want to have their fat,
right,
and then processing the fat and injecting into the butt to sculpt the butt, and make the waist a little bit smaller.
All right, and is that becoming very popular? It's mostly, this is for what, women?
It's mostly for women. Some men also request this, but I would say over 90-95% of my patients are women. It's a procedure that has become very popular over the last maybe 4 to 5 years. Celebrities such as J-Lo, Kim Kardashian, Nicki Minaj have popularized having a large round butt. In the 80s, I guess it was popular to have a very small flat butt, and we've moved away from that now.
So what do you do if you want to be in touch with what's going on in the trends? You take it off, put it on, take it off, put it on? What's the deal with that?
I'm not sure I can answer that question.
Okay. Let's talk about Botox. It's been around for, 20, 30 years maybe, and it's you hear all kinds of Botox, and some of them are not very good at all.
Botox is an amazing medication. It is.
Because you're injecting poison into yourself.
Well, I think that's a great misconception.
Okay.
Botox is not poison. Botox is a purified protein taken from the botulinum bacteria. And what Botox does, it relaxes muscles. It interferes in the ability of nerves to stimulate muscles. When muscles don't get stimulated, they don't move. So it's a muscle relaxant.
Mm-hmm. See, because you see some people, you don't watch television or watch film, and people are totally devoid of any expression in their face. And I'm looking and I see somebody's on television, and he or she is like 45 years old, and on a talk show, let's say, and there's a joke, mm-hmm. and everybody laughs, and that person is laughing, but the forehead is not moving.
Yes. Well, Botox...
That to me is totally unnatural.
Well, Botox, like everything else in life, can be overdone. And the problem is in Hollywood, just because people have millions of dollars doesn't mean they have the ability to get the proper treatment. There's a lot of celebrities that have no facial expressions.
Yeah.
That is not bad Botox, that is bad treatment.
We were talking, I guess you probably heard this from the control room, we're talking about the hack jobs that were done on Mary Tyler Moore, for example. She looks god awful, and I can't imagine how much worse she could have looked had she just allowed her face to age naturally, because she looks terrible. She looks like a cartoon character.
You can take any treatment and make something bad out of it.
Well, it's not like she's short money in her life.
True.
So who is this quack who did the surgery?
There's unfortunately a lot of people that are performing cosmetic treatments. They're not necessarily plastic surgeons, and this is an important issue actually to bring up. Plastic surgery is a designated specialty. Cosmetic surgery is a made-up term, and anybody pretty much can call themselves a cosmetic surgeon or a cosmetic doctor. And there's a lot of people out there injecting things, doing treatments without really proper
But you're an actual plastic surgeon.
I'm a plastic surgeon. I've done my training, which means I've graduated from medical school. I've spent 5 years in a plastic surgery residency training, and afterwards I've done further training in microsurgical reconstruction.
Mm-hmm. Because you can see the amazing work that's been done. I'm just thinking about Operation Herbie, what has been done with those poor little kids over the years, and it's just truly remarkable stuff.
There's a lot of similar procedures. There's something called Operation Smile, for example, where
Yes.
plastic surgeons go out and help children that have all kinds of facial deformities, such as cleft lip and cleft palate. So there's a lot of charity that is being done by plastic surgeons, including Canadian plastic surgeons.
Mm-hmm. And for men, what would be the most popular form of cosmetic surgery, or I'll call it cosmetic surgery for now? Would it be a face tuck?
For men, gynecomastia, male breasts, is a very common
Right.
procedure.
Yeah,
Liposuction is very common. More and more men are getting treatments such as Botox and fillers and facelifts, but that is right now a smaller proportion of the
Right.
population.
You can see my forehead here. See it normally moving.
hmm
You see the line right down there?
Yes, I do.
I have no idea where it came from. What would you do to get rid of that?
Well,
Or just eliminate me? Really your choice.
well, it depends.
Yeah.
So the lines on your forehead, these are called the frown lines and the forehead lines.
Yeah, but this line goes, it's horizontal.
Yes. So these lines come
No,
from
it's
your,
just vertical, up and down. That's vertical, right?
well, your forehead goes up and down, your eyebrows go up and down. Over the lifetime of many times of going up and down, you could develop creases in your forehead, and this
Yeah.
is what Botox
But
is helped to
creases
treat.
normally go across your forehead. This is a line straight
well,
up.
well, you have horizontal lines, you have oblique lines, you have vertical lines,
Right,
and they all represent movement in your face.
right. So this is probably just from like sleeping on one side and it creases while I'm asleep.
Possibly. Can we help with that with Botox? Well, we could numb
No.
you so you don't move.
Yeah. No slip. So what would you do in this case? Would you use filler of some sort?
So looking at your forehead, I would definitely use fillers and Botox. I think
Fillers. Normally she said fillers, like plural.
yeah, so there's a lot of options.
You got enough in the office for me?
Well, I'll have to check. We may have to order some more. No, but seriously, Botox and a combination of Botox and fillers is a great option for lines that we're talking about here.
Mhm.
You have some lines that are very deep, and these lines are permanent. They will not go away with Botox. Botox is a medication, prevents muscle movement, relaxes the muscles.
Right.
So lines which form when you make facial expressions, these are treatable with Botox. Lines that you've had etched into your skin for many, many years, they will not go away, and fillers are the help then.
All right. So in the case of using Botox, is it strictly cosmetic, or is there any kind of medical, practical?
That is a great point that you bring up, because Botox actually initially was used for medical reasons. It was used for blepharospasm, twitching of the eyes. It was used to numb the muscles that were twitching.
Right.
Now, Botox is mostly known for cosmetic purposes, but there are many medical reasons to use Botox. Botox has been shown to decrease headaches, specifically migraine headaches in patients. It decreases sweating in the armpits. It's most recently been described as improving mood in people with low mood.
Okay.
There's a lot of different options.
We're going to take a break, and when we return, which should just be in a few minutes from now, Dr. Martin Jugenburg is my guest. He is from the Toronto Cosmetic Surgery Institute, located at the Royal York Hotel. We'll come back and talk about extremity reconstruction and head and neck reconstruction as well.
It's Saturday with Ted on In-Depth Radio. Newstalk 1010.
Gonna have to put up a little bit of rain for the next few days. Chance of showers today. Is it raining out, Doctor, when you came in?
No, it wasn't.
Okay. High of 17 for today. Chance of showers tonight, down to 15. Tomorrow, chance of showers and 22, chance of showers and 16 on Monday. Mixture of sun and cloud Tuesday. Then we got sunshine. Mike, can you bring the music down a little bit? Thank you. Wednesday, Thursday, Friday, sunshine, and the highs 18, 19, and 20. 16 degrees at Newstalk 1010. Dr. Martin Jugenburg is with the Toronto Cosmetic Surgery Institute. You can find him at the Royal York Hotel. And if you don't know where that is, then you're not from this planet. Let's talk about, just for a second, reiterate the point that you made in regards to cosmetic surgeons and plastic surgeons. You're a certified plastic surgeon, university educated, yet many cosmetic surgeons aren't. They take a course somewhere, they come back, and then they promise you they can make you look fabulous, and maybe they can, but they're not plastic surgeons. And many people are being duped by that. They think, well, if you're a cosmetic surgeon, you must be university trained, but not true.
You're right. It's a major problem. Cosmetic surgery is a very lucrative field, and so a lot of people try to get into this. There is no such thing as a formal cosmetic surgery specialty. When doctors train in medical specialties, they have to be in what's called a Royal College certified specialty. Plastic surgery is one of those, and so it's regulated by the Royal College of Canada. However, cosmetic surgery is a made-up term that was created many, many years ago, and there is no specified specialty. There is no training in cosmetic surgery as a specialty itself, and so there is no regulation. Anybody pretty much can call themselves a cosmetic surgeon. Currently, the laws have changed a little bit, so there is a little more regulation. So to call yourself a surgeon, you actually have to be a surgeon of some kind, general surgeon, ENT surgeon, and then you can be a cosmetic surgeon as a term. If you're not a surgeon, like many family doctors, dermatologists, or internists, then they can call themselves a cosmetic doctor. Now, the problem with the cosmetic field is that there are many treatments that are being done outside in private clinics that are really not being regulated very well and are being done by people that are not really plastic surgeons.
All right, fair enough. I'm interested, what prompted you to enter this field?
My dad. I grew up with my dad being a plastic surgeon. This was back in Czechoslovakia, and he's been a source of, inspiration for me.
Is that Slovakia, or are you talking the Czech Republic?
When I left, it was still Czechoslovakia, so I refer to it like that.
I know.
It's now Slovakia.
What's going on in the world, right?
Yes.
You can't find the countries without a map nowadays. Let's talk about head and neck reconstruction, and talk about something which is very problematic, is skin cancer.
Yes.
Do you see more or less customers in that regard than you did, say, 10 years ago?
I don't think numbers have changed dramatically, but what I would like to point out is that...
But that's sad when you consider. We know a lot about it. How to prevent it.
We do, and people don't listen. But I guess the point I'd like to make is that people don't realize that skin cancer is by far the most common cancer out there. People talk about breast cancer, prostate cancer, but skin cancer outnumbers them all. Everybody has skin cancer. Now, luckily, most skin cancers are not too dangerous. There's a basal cell, squamous cell, and then less frequently is melanoma. Melanoma is a pretty bad diagnosis. When you get melanoma, that requires pretty intense treatment to try to cure it.
It can take your life, can't it?
It easily can.
Wow. Nasal reconstruction. That one is of great interest to me because I had a polyp removed from my nose several years ago because it got to the point where my right nostril was limited to about 25% of airflow. And so they took it out. The doctor was terrific. And then he said, you'll be back in maybe 10 years from now. We'll do it again. I said, what do you mean we'll do it again? He says, you're coming back.
Yes. Polyps can come back.
Why can't you just get rid of it? I don't understand that.
Well, to be honest, I think that would be a question I would refer to an ear, nose, and throat surgeon.
As
a plastic surgeon, what we do when it comes to reconstruction of the nose, it's after cancer when people lose parts or all of their nose.
Right.
A plastic surgeon would then go and create a whole new nose. And there's different ways of doing it, using your own tissues from the forehead, from the forearm. And these are pretty sophisticated techniques that require a lot of intense surgery.
Okay. Without sounding crude or anything, let's talk about reconstructive surgery or plastic surgery on the genitalia. For men,
okay,
this is not, send in your 1895 and we'll make you 3 inches bigger. I don't mean by that. I mean, what kinds of surgeries do you perform in that area?
Well, there's different types of reconstructions. Reconstruction after cancer or injury, and there's also reconstruction in transgender people. Patients.
Have you done that?
Have I done transgender? No, I have not. It's a very, very specialized field.
I would
There are
imagine.
only 2 surgeons in Canada that I'm aware of that do this. So it's a very limited area of plastic surgery.
Mm-hmm. And are men seeing more men now than you have in the past? Are they more vain, if I could put it that way? And I'm not talking about due to illness. I'm talking just strictly, cosmetic, the risk of using that word.
I'm not sure if more men are more vain. I think what's happening is there's more awareness. You see nudity more and more in TVs. This applies to both men and women. In women, labiaplasty and vaginoplasty are surgeries that are becoming very popular. As women, you see more women naked. There's more nudity. People are becoming aware of what labia and the genital area should look like, or what they think should look like, and they're becoming more concerned with the appearance of it.
Mm-hmm. All right, fair enough. Extremity reconstruction. Do you do a lot of that? And what kinds?
Not too much. Luckily, it's for people who have injuries of their extremities, meaning arms and legs, usually after injury or after cancer.
Mm-hmm. So are you seeing a fair amount of people? Not a lot, you're saying, but...
Not a lot. I think things are getting better, especially from trauma. We're seeing less and less horrific, car accidents with better safety, better road safety that's out there. I think that the cancer reconstruction has not changed much, however.
All right. So in general, obviously your practice is doing well.
I think so.
Do you talk to people about the difference, what you're doing, as we mentioned before, and cosmetic surgery, what the difference is and why you're more trustworthy?
I try to educate people when I speak to them, try to explain this, but there's only so much you can do in terms of education. It's really up to the Canadian Society of Plastic Surgeons to increase awareness and education of people so they better understand what plastic surgery is, what cosmetic surgery is. So plastic surgery is this sort of umbrella term which encompasses reconstructive surgery and cosmetic surgery. And this is something that people don't always realize.
And are you hated by cosmetic surgeons?
No, I don't think so. I hope not.
Do you ever work in tandem with them?
Yes.
Do you?
Sometimes we join up to do combined cases. We have more than one plastic surgeon working together. Usually if it's a larger case.
Mm-hmm. All right. I tell you, this has been quite fascinating.
Thank you.
I want to ask you one more question just before, because we've only got about a minute here. What kind of money are you looking at? Not you personally. I'm just saying, like, for the various, for breast reconstruction. What would it cost if you have a mastectomy and you need to reconstruct a breast? Just out of curiosity, is that covered by OHIP?
Great point. This is something that I'd like to bring up, talking about breast cancer. Yes, breast reconstruction is covered by OHIP. This is something people don't realize. So there's no cost whatsoever to breast cancer patients, whether it's breast cancer, head and neck cancer, lower extremity cancer. Cancer reconstruction is covered by OHIP, so there's no cost whatsoever to Canadian patients.
Okay, because I would imagine it would be a fairly expensive proposition.
It would be.
Yeah. And what about a nose job? What would it cost me to get that line ironed out of my head?
Well, those lines in particular, you're looking at $20,000, $50,000, maybe $100,000. I don't know. Just kidding.
Great. I'll be working here for another 17 years daily. Dr. Jugenburg, thank you very much.
Thank you for having me.
You're listening to Saturday with Ted on Newstalk 1010.